Okay, let's picture this for a second. You're home, completely alone, and bam, this crushing weight hits your chest. You're gasping for breath. It feels like the classic signs of a heart attack.
It's a terrifying thought.
It really is. And the big question, the one that probably keeps people up at night if they think about it is, in that moment, would you actually know the exact first few things you have to do to, give yourself the best chance?
Yeah.
Because hesitation, we know hesitation can be fatal.
That's exactly right. And it's such a critical scenario to think through before it happens. When you're alone and facing a medical crisis like that, those first moments are absolutely everything.
So what's our mission today? What are we trying to do in this deep dive?
Our goal is really to cut through any confusion, any uncertainty, and give you a really clear step-by-step plan, based on evidence, of course.
Right.
We want to break down those crucial actions, starting with the one thing that is, well, arguably the most vital.
All right, let's dive right in then. The first thing, it involves your phone, right? Tell us about that.
Yes. Your phone is your lifeline. If you're alone and get those sudden symptoms, that intense chest pressure, maybe pain spreading, severe shortness of breath, that awful sense of panic.
Yeah.
The single action that demonstrably boosts your survival chances more than anything else is calling emergency services.
Yeah.
911 or whatever your local number is.
And this isn't just like old wives' tales. This is solid medical fact.
Absolutely. Solid medical understanding. But here's the tricky part. Our instincts in that moment, they can actually work against us.
How so?
Well, think about it. You're scared, you want comfort, maybe you want to talk to someone you trust. So the first thought might be, I'll call my spouse or my kids or a neighbor.
That seems natural.
Totally natural. Or the other instinct might be pure flight. I need to get to the hospital now. So you think about grabbing your keys and driving.
Right. The urge to take control, do something.
Exactly. But both of those instincts, while understandable, introduce really dangerous delays. Calling family means they then have to react, maybe call 911 themselves or come get you. It all takes time. And driving yourself, that's incredibly risky.
We hear that a lot. Why is it so bad?
Several reasons. Your symptoms could suddenly get much worse. Imagine like crushing pain, intensifying or getting dizzy, or even losing consciousness while you're behind the wheel.
Oh, wow, yeah. That's a disaster waiting to happen.
It is. You're endangering yourself and everyone else on the road, plus you're completely bypassing the immediate medical care that paramedics can provide before you even get to the hospital.
Ah, okay. So that's the key difference then. Calling 911 brings the medical help to you rather than you trying to get to it.
Precisely. That's the core insight. Paramedics bring the emergency room essentially to your doorstep.
So what exactly can they do that makes such a difference?
Well, first off, they're highly trained medical professionals. They can start life-saving treatment the moment they arrive.
Right there on the spot.
Right there. They carry equipment. You just don't have defibrillators if your heart goes into a dangerous rhythm, oxygen to help you breathe, sophisticated monitoring devices. And they can administer certain medications under protocol, like aspirin, maybe nitroglycerin if appropriate. They assess you immediately.
And it comes back to that saying, time is muscle, doesn't it?
Absolutely. Every single minute that blood flow is blocked to a part of your heart, muscle cells are dying from lack of oxygen.
And that damage can be permanent.
It can be. The longer that delay, the greater the damage, which can lead to long-term problems like heart failure, or worse, it could be fatal.
Well,
Calling EMS triggers a rapid, coordinated response.
so they get there fast, treat you fast, and get you moving fast.
Yes, and importantly, they get you to the right hospital, often one with a specialized cardiac care unit ready to go.
You mentioned the ambulance being like a mobile emergency room. Can you expand on that a bit?
Sure, think about it. They can give you oxygen, start an IV line for fluids or medications, help manage your pain, and crucially, they are constantly monitoring your vital signs and heart rhythm.
Which you definitely can't do driving yourself.
Not a chance. And if the worst happens, if you go into cardiac arrest, they are right there, equipped and trained for immediate CPR and defibrillation. That's immediate life support.
Wow.
And there's another piece, communication. Paramedics can often transmit vital information, like your ECG, directly to the receiving hospital while they're en route.
So the hospital knows you're coming and what's wrong.
Exactly. It allows the emergency department and the cardiac team, maybe the cath lab folks, to get ready. They can assemble the team, prepare the equipment. It saves precious time the moment you arrive through the door.
That makes a huge difference, I imagine.
It really does. And just practically, they have sirens and lights. They can navigate traffic much more effectively and safely than you could, especially if you're feeling terrible.
Okay, but what about that nagging feeling?
Mm.
What if it's not a heart attack? If
Yeah.
I call 911, they rush over, and it turns out to be, I don't know, really bad heartburn or anxiety. People worry about false alarms, right?
That's a very common and understandable fear. But the medical community is really clear on this.
What do they say?
They would much rather you call if you even suspect it might be a heart attack. Err on the side of caution, always.
Okay.
Emergency responders, doctors, nurses, they understand symptoms can be confusing. They are there to help. Getting checked out immediately for potential heart attack signs is never an overreaction. It's the responsible thing to do.
So don't let the fear of being wrong stop you from making that call.
Absolutely not. They would far prefer to assess someone and find out they're okay than have someone wait too long because they were unsure and end up with preventable heart damage.
Okay, so just to hammer this home,
Yeah.
the absolute number one first thing you do if you think you're having a heart attack, especially alone.
Call 911 or your local emergency number immediately. That single action connects you to trained professionals, advanced life support, immediate treatment, and fast, safe transport. It truly is your lifeline.
Got it. Lifeline call first.
I
Okay,
know.
so the call is made. Help is racing towards you. What's next? We hear a lot about aspirin. Is that the second step?
It often is the recommended second step, yes.
Mm.
Many people know aspirin is somehow involved with heart attacks, but the specifics are really crucial.
Right, like is it always okay to take? How much? Does the type matter? How do you even take it?
Exactly. And getting those details wrong could potentially be harmful, or at least not helpful. So let's break it down.
Okay, what does aspirin actually do in this situation?
Its main job is as an antiplatelet agent. To understand why that matters, you need to know what typically causes a heart attack.
Okay.
Usually, it's a blood clot forming in a coronary artery, one of the arteries feeding your heart muscle and blocking the blood flow. This often happens where there's been a buildup of fatty plaque that suddenly ruptures.
Right, I've heard of plaque rupture.
So blood platelets are these tiny cells in your blood that rush to the site of injury or rupture and start clumping together to form a clot. Aspirin works by making these platelets less sticky.
Ah, so it interferes with the clot forming.
Precisely. It inhibits them from clumping up as effectively. This can help prevent a new clot from forming or stop an existing clot from getting bigger. It essentially gives your body a chance to start breaking down the clot and limits further damage while you wait for more advanced help.
So it's kind of buying time, limiting the damage while the paramedics are on their way.
That's a great way to put it. It's minimizing the heart muscle damage while awaiting definitive treatment.
Okay, so the dose. How much should someone take?
The standard recommendation for an adult suspecting a heart attack is one regular strength aspirin tablet, which is usually 325 milligrams.
325 milligrams. What if you only have baby aspirin?
Good question. Low dose or baby aspirin is typically 81 milligrams. In that case, you take 4 of those tablets to get close to the recommended dose, so about 324 milligrams total.
4 baby aspirin. Okay.
Yeah.
And you mentioned the type matters. Plain versus coated.
Yes, this is important. If possible, use plain, uncoated aspirin, not the enteric-coated kind.
Why not the coated ones? Aren't they supposed to be gentler on the stomach?
They are for long-term use. But that coating is designed to make the tablet dissolve slowly, usually in the intestine rather than the stomach.
Ah, so it takes longer to work.
Exactly. In an emergency, you want that aspirin absorbed into your bloodstream and starting to work as fast as possible. Plain aspirin dissolves much quicker.
Okay, plain 325 milligram tablet or 4 81 milligram plain tablets. And how should you take it? Just swallow it.
No, and this is another critical point. You should chew the aspirin thoroughly before you swallow it. Don't just gulp it down with water.
Chew it, really? Why?
Chewing breaks the tablet down into tiny particles. This massively increases the surface area.
Okay.
That allows it to be absorbed much more rapidly. Some absorption might even start right there in your mouth through the lining and then quickly in the upper digestive tract. Swallowing it whole means it has to travel further and be broken down before absorption really kicks in.
So chewing means faster action.
Much faster action.
Yeah.
And when time is muscle, faster is better.
Makes sense. But hang on, is aspirin safe for absolutely everyone in this situation? Are there times you shouldn't take it?
Yes, absolutely. There are definite contraindications, situations where you should not take aspirin.
Like what?
Number 1, if you have a known allergy to aspirin or other NSAIDs, non-steroidal anti-inflammatory drugs, an allergic reaction is the last thing you need.
Okay, allergy is a no-go.
Also, if you have an active bleeding disorder, like hemophilia, or if you've had recent significant bleeding, maybe from a stomach ulcer, aspirin interferes with clotting, so it can make bleeding worse.
Right, increases bleeding risk.
Exactly. Also, if your doctor has specifically told you not to take aspirin for some other medical reason, you need to follow that advice.
Okay.
And one more important one, if you're already taking prescribed blood-thinning medications, drugs like warfarin, or maybe newer ones like apixaban or clopidogrel,
Yeah.
taking aspirin on top of those without medical guidance could seriously increase your risk of dangerous bleeding. In that case, it's best to just wait for the paramedics to assess things.
So, quite a few things to consider. But what's the absolute priority here? Aspirin or the 911 call?
The 911 call, always, without question. Taking aspirin, even if it's appropriate for you, should never delay calling for emergency help.
So call first, then think about aspirin if it's safe and easy to grab.
Precisely. Don't waste precious seconds hunting for the aspirin bottle if it means putting off that emergency call. The professional medical help is far more critical.
And just to be clear, aspirin isn't a cure, right? It doesn't fix the heart attack itself.
Correct. It's a supportive measure. It helps limit the damage and prevent further clotting while you're waiting for the treatments that can fix the problem, like clot-busting drugs or procedures like angioplasty to physically open that blocked artery.
Okay, so quick recap on aspirin. Call 911 first. Then, if no allergy, no bleeding issues, not told otherwise by a doctor and not on other blood thinners, chew one 325 milligram plain aspirin or 4 81 milligram plain baby aspirins.
That's the sequence. Call first, then consider aspirin.
All right, call made, aspirin may be taken, paramedics are en route. What can you practically do while waiting to help you faster?
This is about removing obstacles, making it as easy as possible for them to reach you the second they arrive. Because again, every single second counts.
Right.
Think about it. You've called for help. They're rushing there. The last thing anyone wants is for them to be stuck outside banging on a locked door.
Especially if you're getting worse inside.
Exactly. What if you become unconscious or too weak to get to the door while they're trying to figure out how to get in? That delay could be critical.
Okay, so the obvious step then is?
Unlock your front door. If you are physically able to do it without straining yourself or making your symptoms worse, that is the single most important practical step.
Just the front door.
Well, primarily the front door, but also think about any other barriers. A porch door, a security gate at the end of the drive, a garden gate. If it's safe and easy for you, unlock those too.
What about apartments or secured buildings?
Good point. Be ready to buzz them in remotely if you can, or if you spoke to a concierge or building manager when you called 911, hopefully they're prepared. The goal is just clear access.
It seems so simple, but yeah, if they have to break down a door, that's valuable time lost.
It is. Time spent forcing entry is time not spent assessing and treating you. So, unlocking is key.
Anything else practical?
Another helpful thing, especially if it's dark or maybe your house number is hard to see, is to turn on an outside light if you can do it safely.
Like a porch light?
Yeah, a porch light, maybe a driveway light, anything that helps them spot the right house quickly. They're responding under pressure, maybe in an unfamiliar area. A light can be like a beacon.
Helps them zero in faster.
Mhm.
Okay, what about gathering your medical info, like your list of medications? Should you be running around trying to find that?
Okay, this is important. If you have that information list of meds, allergies, major conditions readily available, like right there on the fridge or in your wallet, and you can grab it without any strain, then yes, having it ready is helpful.
But only if it's easy.
Absolutely. Do not exert yourself searching for it. Your priority right now is resting and minimizing strain on your heart. If it's not immediately accessible, don't worry about it. They'll ask you or figure it out. Focus on the door and resting.
Got it. And pets. What if you have a dog or cat?
If it's safe and quick for you to do, maybe shooing them into another room and closing the door is a good idea.
How is that?
Sometimes pets can get agitated or scared when strangers, especially uniformed paramedics, rush in. They might get underfoot or even try to be protective.
Or just get scared and run out the open door?
That too. Securing them just keeps them safe, keeps them out of the way, and lets the paramedics focus entirely on you without distractions. But again, only if it's quick and doesn't stress you out.
So all these things, unlocking, light, maybe pets, they're all about smoothing the way for help to arrive and work efficiently.
Exactly. Removing obstacles, saving seconds or minutes, which leads directly to faster care and potentially a better outcome.
Okay, doors unlocked, light might be on, help is definitely coming. You're waiting. That must be an incredibly scary few minutes. How should you manage yourself physically during that wait?
It absolutely can be terrifying. But how you position yourself and even how calm you manage to stay can actually influence the strain on your heart.
Okay.
You've done the big thing, called 911, maybe take an aspirin, unlock the door. Now it's about minimizing any further stress while you wait.
So no pacing around, trying to walk it off.
Definitely not. Any kind of physical exertion is exactly what you want to avoid. The key now is rest and trying as much as possible to stay calm.
Easier said than done, I imagine.
Oh, absolutely. But it's important physiologically. When you're anxious or panicked, your body releases stress hormones like adrenaline.
Right.
And those hormones ramp up your heart rate and your blood pressure. That puts extra demand on a heart that's already struggling because it's not getting enough oxygenated blood.
So panic makes the heart work harder when it needs to rest.
Precisely.
Yeah.
So even though it's incredibly hard, try to take slow, deep breaths. Focus on the fact that help is on the way. Anything to try and manage that fear.
And physically, what's the best position? Lie down flat, sit up.
The generally recommended position is semi-reclined. Think sitting up, but leaning back against something for support.
Like against the back of a sofa or propped up with pillows in bed or against a wall.
Exactly. That kind of position tends to be best. Lying completely flat can actually make breathing more difficult for some people during a heart attack, maybe due to fluid building up slightly in the lungs.
Okay, so not flat and not standing or walking.
Right. Standing and walking increases the heart's workload. That semi-reclined supported sitting position helps reduce the effort the heart needs to pump blood, and it often makes breathing feel easier, which helps with oxygen intake.
So find a comfy-ish spot, sit up, lean back.
That's the goal. Find the position that allows you to breathe most easily with the least amount of effort.
Now, what about nitroglycerin? If someone has that prescribed for chest pain, like angina, do they use it now?
Okay, this is specific. If and only if you have been prescribed nitroglycerin, GTN, by your doctor for chest pain, and your doctor has specifically told you how to use it during suspected heart attack symptoms, then yes, you should use it exactly as prescribed.
Usually under the tongue, right? Tablet or spray?
Correct. It works by helping to widen the coronary arteries, which might improve blood flow a bit and could possibly ease some chest pain.
But it's not fixing the main problem.
Not usually, no. A heart attack is typically caused by that persistent blood clot blockage. GTN is often more effective for angina spasms rather than a full-blown clot. As Professor Tang points out, it's more for angina relief.
So it's absolutely not a substitute for calling 911.
Never. Not ever. Taking GTN should never delay or replace that emergency call. It might offer temporary relief, but the underlying issue needs urgent medical attention.
Are there side effects to watch for?
Yes, common ones are headache and sometimes a drop in blood pressure, which can make you feel dizzy or lightheaded.
And if the pain doesn't get better after using it?
That's actually important information for the paramedics. It reinforces that something serious is likely going on.
So the big principle here is minimal exertion, maximum rest while waiting.
Exactly. Avoid any strenuous activity. Don't try to gather clothes or tidy up. Just sit, rest, try to stay calm, and wait for the professionals. Even small efforts increase the heart's oxygen demand.
Okay, so call 911, maybe aspirin, unlock door, rest semi-reclined, maybe use prescribed GTN. That covers what to do. But you mentioned instincts can be wrong. What about things you absolutely should not do?
Yes, knowing the don'ts is just as critical as knowing the do's. There's a lot of misinformation or just bad instincts that can really harm you or delay proper care.
Okay, hit us with the big ones. What's top the don't list?
We've touched on it, but it bears repeating loud and clear. Do not drive yourself to the hospital.
Even if it feels faster.
Even then, the risk of your symptoms suddenly worsening, overwhelming pain, dizziness, passing out while driving is immense. It's dangerous for you, dangerous for others. And crucially, you miss out on all that immediate life-saving care the paramedics provide en route. Let them come to you.
Okay, no driving yourself. What else?
Don't rely solely on nitroglycerin, even if it helps the pain a bit. Remember, it doesn't stop the heart attack itself.
So don't think, oh, the nitro helped. I'm fine now. I won't call 911.
Exactly. That's a dangerous trap. If the symptoms made you think heart attack, you need to call 911, regardless of whether GTN gave temporary relief.
Got it. What about that cough CPR thing?
Total myth. Dangerous myth, actually. It is not a recognized or effective treatment. Vigorous coughing puts extra strain on an already struggling heart and won't fix the kind of chaotic heart rhythms usually seen in cardiac arrest. Don't do it.
Okay, cough CPR is out. What about pushing on your own chest?
No. Unless someone trained is doing proper CPR because you're unresponsive, just randomly pushing on your chest while you're conscious doesn't help and isn't recommended.
Any folk remedies to avoid, like cayenne pepper or something?
Definitely avoid those. There's zero scientific evidence they work, and relying on them just wastes critical time when you need real medical help. Stick to the proven steps.
Makes sense. Should you avoid eating or drinking?
Generally, yes. Apart from chewing the aspirin and maybe a tiny sip of water with it, avoid eating or drinking anything substantial. It could potentially complicate things later at the hospital, especially if procedures or anesthesia are needed.
Okay. And maybe the biggest don't of all.
Do not ignore your symptoms or wait to see if they go away. That wait and see approach is incredibly dangerous.
Because time is muscle.
Exactly. Every minute you delay, more heart muscle is potentially being damaged irreversibly. Don't dismiss chest pain, shortness of breath, or other classic symptoms as just indigestion or stress. Get it checked out immediately. Call 911.
Trust your gut, or rather, trust your symptoms and make the call.
Absolutely. Acting fast on those proven steps and actively avoiding these common mistakes gives you the best possible chance.
Okay, this has been incredibly valuable. Let's just quickly recap those absolute lifesavers for someone alone and suspecting a heart attack.
You got it. Number one, top priority. Call 911 or your local emergency number immediately. Don't delay.
Step 1, call.
Step 2, if appropriate for you, meaning no allergies, bleeding issues, etc., chew 1 325 milligram plain aspirin or 4 81 milligram plain baby aspirins.
Step 2, aspirin, chewed, if safe.
Step 3, if you can do it safely without strain, unlock your front door and any other gates or access points. Maybe turn on an outside light.
Step 3, unlock and make access easy.
Step 4, rest. Sit down, lean back against support, stay as calm as possible, don't move around.
Step 4, rest semi-reclined, stay calm.
And optionally, step 5, if you have prescribed GTN and instructions for this scenario, use it as directed, but never as a substitute for calling 911.
That sequence call, aspirin, unlock, rest, that's the protocol.
That's the evidence-based protocol that maximizes your chances.
This is information everyone should know, seriously.
It really is. We absolutely encourage you to share this with your family, your friends, your colleagues. Knowing these steps could save a life.
And beyond this immediate crisis response, things like learning CPR, talking to your doctor about your personal heart risk, those are important too.
Hugely important. And of course, the best approach is prevention, regular checkups, managing risk factors, healthy lifestyle choices. That's how you reduce the chances of needing this information in the first place.
Well said. Thank you for taking this deep dive with us today. This is truly vital knowledge.
Thank you. Being prepared really is empowering.
It really shows that in those terrifying moments, knowledge and quick, correct action can make all the difference in the world.